Back again, guys, here with one of the series for the first aid. Right here we have the kit that I do keep in my truck. I consider this more of a truck kit, range kit. This usually gets thrown in the range bag when I go to shoot, or when I'm hunting. I'll take this and put in my bag as well. I don't like to mess around with first aid a whole lot in terms of taking things lightly. I know my medical information. I know my wilderness first aid and my basic first aid, and outside of that it's really not worth taking chances. So I do make sure to have everything that I do need, and later on in the video I'll explain some different points of view and some different medical facts about tourniquets, tourniquet use, and improvised tourniquets. So we'll open this up. This is actually a pack that I got off of Amazon, 300-piece kit for around 20 bucks. Not sure if they still have that. Anyways, start with the stuff. I've got some basic aspirin here, 350 milligram, entire bottle of that. You never know when you're going to need that, and I actually did use some today. I always have a plethora of knives on me, but I do keep, just in case, I keep a real cheap, this is a cheapo Swiss Army knife. I don't even think it has a brand name, just in case, because this is honestly better than nothing. So this is one of the things that I do keep in the kit. And on the same line of tools, I keep a cheapo multi-tool. And these things are probably 5 to 7 years old, but it's better than nothing. I'm not going to keep a Leatherman in here, or my Gerber Diesel, because I need them for other things. So that's essentially the tools that I do keep in here. On this side, I keep spray hand sanitizer. I've got my medicines on this side, ibuprofen, aspirin, non-aspirin, stomach pills, and I also have some really strong ibuprofen as well, some 650 milligrams. I like to keep Ear Pro whenever possible, just in case, and I have those in my everyday carry kit as well, inside my hiking bag. Got about 12 feet of paracord here, just in case. And then all of these are either trauma pads, basic band-aids, or butterflies. And that's what this entire side is dedicated to. Sterile pads, trauma pads, band-aids. Over on this side I've got a small stock of moleskin. I've got some examination gloves, some gauze, ointments, burn cream, alcohol cleansing pads, iodine pads, pretty much everything you would need to treat the wound. In one of my other videos I explained how I don't like hydrogen peroxide, and if you want to read up more on that, I suggest you do it. Down in the pack here I've got some, and it's kind of hard to see there, I've got some, these are Q-tips. I've got some tweezers, one-time use temperature. I've got my small forceps in here, and I also keep a couple different rolls of med tape. Down here, I'm not going to take all this out because I don't want to pack it back in, but I've got an emergency blanket inside of this paper bag. I have jute twine wrapped around a piece of 4-inch by 4-inch dryer lint, which is tinder for the fire steel, that I keep in my truck's survival kit, which is different than my med kit here. And I also keep dental floss, and I don't keep it for my teeth. I keep it because dental floss is some of the best cordage you could possibly have. It's real tough stuff. I've got some splints here, larger ones, smaller ones, some cold packs right here, 2 of those. I've got, of course, hand warmers down in here. And for someone, you know, if I'm hurt and I'm relying on someone to take care of me, there is an emergency first aid guide in here by the Red Cross. Moist towelettes, things to wash my hands. Now the last part of the video I said that I would explain kind of tourniquet use. Now I don't have a combat application tourniquet with me, but I will explain a little bit why paracord use for a tourniquet is a huge no-no. And why something even like this, which I keep in my hiking kit, would work worlds better than paracord. Okay. Just like an Israeli combat bandage, when you're looking at the thickness of a strap or of cord, you're looking at this paracord right here. It's probably about a little under an eighth of an inch thick, around an eighth of an inch. If you apply this to an arm or a leg to cut the circulation off of the affected area, you go up about 2 inches over the wound, 2 to 4 inches over the wound, depending on the severity, and apply your tourniquet. Now, the reason you don't use 550 cord is because 550 cord doesn't have the overall area to correctly clot the arteries and all the extremities into the wound. You don't actually have enough surface area to do that. You're actually hurting more than you're helping because you're applying pressure, but the pressure could have an adverse effect and you could end up losing a lot more blood than you think. So if you are in a situation where you have paracord, you need to apply a tourniquet, and note that applying a tourniquet is an absolute last resort, and that you understand that when you apply a tourniquet, you are exposing yourself to any medical assistance type laws that your state may have. They have different names per state, but you're also exposing yourself to the scrutiny of sacrificing that person's limb. So when you make that decision, you are saying, this limb is going to be sacrificed, this limb will no longer be able to be used, and I'm doing this action to save the person's life so they do not bleed out. So you're much better off to use a t-shirt or something thicker, or even belts aren't half bad if you can apply it the right way. Don't use 550 cord, don't use wire. I wouldn't suggest anything under an inch thick, and even something like this isn't great. It's just much better to have a good 4-inch tourniquet or a 3-inch tourniquet, because that just works the best. Now, I will venture to say, however, that this would not do a terrible job. As you can see right here, the locking mechanism on this, it is the gator grip, as I call it, type. You can see a little bit there. Pull it through, you grip it, you can turn it and actually allow yourself. You could put a windlass in there and turn it. Use something such as a windlass if there's a piece of steel bar around or something of that sort. Anything strong enough to make a windlass that doesn't break, to really tighten it up. So this is overall some medkit information, my daily medkit for my truck, and maybe eventually I'll go over my my truck survival kit. But there you go, guys. Enjoy.